celebrate 20 years of Immunopaedia. So two decades of commitment to bridging science and public health, and 2 decades of creating opportunities for African scientists to thrive. Um, Tammy has talked a lot about our journeys, our joint journeys. My journey mirrors hers quite closely. But today I want to give you a little bit of a backstory about my connections to Immunopaedia. I first met Professor Clive Gray, at an Elizabeth Glaser Pediatric AIDS scientific retreat in Florida, White Oak, Florida, where scientists working on pediatric AIDS and had gathered. Most of the participants there were basic scientists focused on developing an HIV vaccine or a cure so that children would survive without this horrible disease. And while clinicians like myself, a pediatrician, we worked on preventing HIV vertical transmission and pediatric HIV treatments. So it was an interesting hybrid of professionals coming together. Listening to each other across these disciplines felt like hearing a foreign language that you did not understand. So just imagine somebody speaking in Chinese and you're answering in French, and none of you understand each other's languages. That's the way we felt. And as the dean spoke earlier on, as clinicians, we were fairly literate in immunology. We operated in different worlds. It was therefore a really welcome relief when Clive received the Elizabeth Glaser Pediatric AIDS Foundation award, the Leadership Award, to enable him to establish Immunopaedia. And basically, as it was conceived at that time, it was going to be an online immunology learning platform. And I had the privilege of speaking at that launch of Immunopaedia in 2005 during the South Africa AIDS conference in Durban. Now, it was 20 years ago, so you forgive me if I don't remember every detail of my speech. But what I do remember um, about that time was the excitement in the room as this initiative was launched, because we saw it as a way that we could bridge the disciplines and begin to talk more productively with each other. The vision was clear. It was to empower basic scientists, particularly in pediatric immunology, to conduct impactful and applicable research in HIV and to bridge the divide between immunologists, clinicians, and epidemiologists by making immunology more accessible. Now, over the past 2 decades, Immunopaedia has grown tremendously, and I guess everybody sitting in the room can attest to that. It has far exceeded the initial expectations in both the reach and the scope. It has become a global leader in immunology education and is now the official education site for the International Union of Immunology Societies. So while it initially focused on making immunology knowledge accessible, it has expanded from the online learning to collaborations and mentorship programs, empower scientists across Africa and beyond. So I sit here, having been at the initial launch, feeling so proud of what Immunopaedia has actually achieved. The ripple effect of this work is immeasurable, and we'll continue to try and measure it, but it's going to be hard because it has spanned so many areas of the work that we do. It extends beyond the classrooms to the labs. It has impacted policies and healthcare systems and communities of people living with HIV and those affected. So this platform, starting as a small seed in 2005, has had that reach. Today, as we celebrate this milestone, let us look ahead. I always like to sort of say, so what next? The future looks bright from where I'm sitting because Immunopaedia has laid a really strong foundation and shown how we can con- collaborate across disciplines and shown that we can use simple platforms and innovative platforms to be able to reach each other and talk to each other. I believe that it will continue to inspire, to educate, and transform science for generations to come. So let us take a moment together to applaud all the visionaries, the educators, the researchers, and the supporters who have made this journey possible. Your dedication has shaped an incredible legacy, and I'm proud to be associated with you guys. Here's to 20 years of impact, and to many more ahead. Thank you very much.
Thank you very much, Joy.